Yes, I give you permission to do an assessment.
Hello, Miss Amos. My name is Allie. I'm a nurse practitioner student. I'm going to be helping out, taking care of you today. Can you verify your name and date of birth?
Susan Amos, 123, 1962.
Awesome. So I'm going to start by washing my hands and providing us some privacy, okay? So we're going to be doing a cardiac and a respiratory exam. So we're going to actually start by doing your posterior chest. So if you don't mind just standing up and turning around. Perfect. So I'm going to first note that the color of your skin is uniform. The skin is warm with no moisture noted. I don't notice any bruising or scarring. I notice several small nevi located throughout your upper portion of your back. However, they're distinct borders and are less than 1 millimeter in size. I notice that your breathing is unlabored and with symmetrical expansion on both sides as well. I notice a regular rate and rhythm, and I don't see any signs of respiratory distress right now with the use of accessory muscles such as tripod positioning, nasal flaring, retractions, tachypnea, or cyanosis. And I don't notice any obvious deformities. I'm going to next palpate your back, and what I'm going to do is I'm going to place my thumbs on the 10th rib level, grasping and holding your rib cage, and I'm just going to ask you to inhale and exhale. And I see that my thumbs expand equally on both sides, so I think that your chest expansion is symmetrical. The next thing I'm going to do is place my hands in several locations on your back and just ask you to say 99, okay?
Okay. 99, 99, 99, 99, 99.
So that's the tactile firmitus test, and I notice that you have symmetrical tactile firmitus on both lungs, and this is a normal test. So the next thing that we're going to do is percuss your back. So I'm just going to be tapping on your back in a few places, okay?
Okay.
And I notice that there's resonance throughout your bilateral lung fields, which is a normal finding as well. The next thing that we're going to be doing is auscultating and listening to about the same spots that I just percussed. I'm just going to have you take deep breaths for me, okay?
Okay.
And wonderful. There was clear breath sounds noted throughout both lung fields. I didn't notice any adventitious sounds such as rails, crackles, wheezes, or rhonchi, which is a normal finding as well. The next thing we're going to be doing is I'm going to actually listen to those same roughly 8 spots again and do a test called egophony. So I'm just going to have you say E and just hold it long E, okay?
Okay. E, 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 E.
Wonderful. And those E sounds did not turn to A sounds, so no egophony is present, which is a normal finding. So the next thing that we're going to do is actually use those same spots and do a test called bronchophony. And I'm going to have you say 99 at all of those places, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
You're negative for bronchophony, which is a normal finding because those sounds were muffled and indistinct. And if they were loud and clear, that would have been a positive exam. So the next thing we're going to do is one more time, I'm going to place my stethoscope in those same spots, and I'm going to have you whisper 1, 2, 3, okay?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And you're negative for the whisper pictililoquy test, which is a normal finding because those whispered 1, 2, 3s were faint and indistinct, okay? So I'm going to have you sit down, and so the next thing that we're going to do is listen to you over a few places on your chest, and I'm going to tell you about them, okay?
Okay.
I'm going to start by listening over the tracheal. And loud, harsh sounds were noted. Bilaterally, and inspiration and expiration were equal, which is a normal finding. The next place we're going to listen to is over the bronchovesicular area. Just keep breathing normally, okay?
Okay.
Wonderful. And inspiration and expiration sounds were almost equal there as well, which is also a normal finding. And those are normally heard over the first and second intercostal spaces between the scapula, okay?
Okay.
And the last thing that we're going to listen to is over the vesicular area, okay? So just keep breathing normally. Normally I would go straight onto skin. Let's see if we can do it. Perfect. And inspiration sounds actually last longer in the vesicular area than expiration sounds, which is normal, and those are heard over your lung fields, okay? So we'll continue on with the anterior chest portion of this, okay? I'm going to start with an inspection. I note that the color of your skin is fair and uniform throughout. I notice that the skin is warm with no moisture noted. No bruising or scarring is noted either. No lesions. I see several nevi located on your chest, but they are distinct borders and small in size. And I don't notice any obvious deformities. I also notice that you have symmetrical bilateral breaths and on both sides as well. So I'm going to actually now palpate your chest, very similar to what I did on your back. And I'm just going to place my thumbs along and have you take a deep breath and inhale and exhale, okay? Perfect. So I noticed that when my thumbs expand, your chest diverges and expands equal bilaterally, okay? Which is a normal finding. So the next thing that we're going to do is the same 99 test. I'm going to place my edges of my hand on several places on your chest, and I'm just going to have you say 99, okay? It's checking for tactile firmness.
99, 99, 99, 99, 99.
Wonderful. So as I palpated your chest, there was symmetrical tactile firmness noted, which is a normal finding as well. We're going to move on to auscultating your chest. So I'm going to listen to you take breaths. Just breathe normally though, okay?
Okay.
I'm going to place my stethoscope on your chest. Wonderful, and clear breath sounds were heard bilaterally throughout both lung fields. No adventitious lung sounds were noted, such as rales, rhonchi, wheezes, or crackles, which is a normal finding. So we're going to move on to do the cardiac exam, okay? So what I'm going to do is I'm going to be listening to a few points, and I'm going to listen to with the bell and the diaphragm. And I'm going to explain them the first time, and then we'll carry on, okay? So I'm going to listen with the first shot at the aortic, which is in the second intercostal space on the right-hand side. Just breathe normally. Second intercostal space on the left side, I'll be listening at the pulmonic spot. The next portion I'm going to listen to is I'll have you displace your breast. I'm going to be listening at the herbs point, which is the third intercostal space on the left-hand side. Perfect. Now I'm going to listen to the tricuspid, which is right here, the fourth intercostal space. Perfect. And the last thing I'm going to be listening to is the mitral, which is the left fifth intercostal space, medial to the midclavicular. So if you'll just displace your breast. Perfect. I'm going to do all those 5 spots again, but with listening with the bell this time.
Okay.
Aortic, pulmonic, and displace your breast and do the herbs point. Tricuspid, and then mitral. Perfect. And normal rate and rhythm were noted with a normal pitch as well. No murmurs or extra sounds were noted in any of those locations, which is a normal finding as well. So what I'm going to do now is listen for apical pulse, and I'll be listening to it for 1 minute. So
Okay.
it's going to be in the fifth intercostal space, midclavicular line. Okay?
You want me to move my breast? I guess?
Yep.
Okay.
Perfect. And our apical pulse was 68, which is normal. I'm going to actually carry on the next portion of the exam in another room, okay?
Okay.
So for the next portion of the exam, what I'll be doing is I'll be getting to the patient's level and noticing that I don't see any heaves or lifts noted on the patient's chest, which is a normal finding. The next thing I'm going to be doing is palpating over those 5 spots that I had listened to earlier, and I'm going to be noticing if there's any thrills, okay?
Okay.
Aortic, pulmonic, herbs point, displace your breast, thank you, tricuspid, mitral, and no thrills were noted, which is a normal finding. So the next portion I'm going to do is I'm going to actually auscultate with the bell and the diaphragm, same thing I did earlier, over those 5 points, okay?
Okay.
Perfect. And just breathe normally, okay? Aortic. Pulmonic. Herbs point. If you'll displace your breast. Tricuspid. And then the mitral. Perfect. And we're going to read through that and listen to all those 5 points with the bell now, okay?
Okay.
Okay. Aortic. Pulmonic. Herbs point. Tricuspid. And mitral. And there's a normal rate and rhythm noted, and no abnormal pitches, which is a normal finding as well. No murmurs were noted as well. So the next thing I'm going to do is actually have you help me out so we can check to see if you have any jugular vein distension, okay?
Okay.
All right, so for jugular vein distension, I have the head of the bed that we're mimicking at roughly 30 to 45 degrees. I'm going to have you hold my ruler at the sternal angle, and what I'm going to do is have you look to your right and then measure from the point at which I can see the top of the pulsation, and I'm getting roughly 2 centimeters on your right hand side, and I'll be doing that again on your left hand side.
Okay.
That's all right, we'll just turn it this way. I'm gonna pull back your...
Is that okay?
Yes. Let's see. To the point. And it's 2 centimeters on that side as well, which is a normal finding.
Okay.
So no jugular vein distension is noted. Awesome. Thank you so much for your help.
All right, thank you.